Welcome back to the channel. Today's topic is hypertension and management. Steps for accurate blood pressure measurement. Before measurement, provide a quiet environment at comfortable temperature. Explain the procedure to be performed. Check that the patient has not smoked or ingested food, coffee or alcohol at least 30 minutes, has had at least 5 minutes of rest. During measurement, do not have conversation. Support arm at heart level. Put the cuff on bare arm. Use correct cuff size. Support feet on the floor. Keep leg uncrossed. Empty bladder first. Support the back. After measurement, obtain a second measurement with an interval of 30 seconds. Register both measurements without rounding and calculate the average to obtain the final result. Causes of hypertension: primary or essential hypertension 90 to 95% of cases, secondary hypertension 5 to 10% of cases due to underlying condition like kidney disease as CKD or renal artery stenosis, endocrine disorder like thyroid disease, Cushing syndrome, pheochromocytoma, hyperaldosteronism, certain medication like NSAID, steroid, oral contraceptive or decongestant, obstructive sleep apnea, aortic coarctation. Why control of blood pressure is so important? Hypertension is major risk factor for stroke, heart failure, kidney disease. Goal of treatment: less than 130 by 80 millimeter mercury. Hypertension grade: optimal less than 120 by 80 millimeter, normal systolic 120 to 129, diastolic 80 to 84, high normal systolic 130 to 139, diastolic 85 to 89. Grade 1, grade 2 and grade 3. Grade 3 is the systolic more than 180 or 180 and diastolic 110 or more. Isolated systolic, where systolic pressure is 140 or more but diastolic is less than 90. Management: lifestyle management first, non-pharmacologic approach, dietary approach to stop hypertension, that is dash diet, plenty of fruits, vegetable with low salt. Weight loss: per kg weight loss causes 1 millimeter mercury fall of blood pressure. Salt restriction less than 2.3 gram per day. Potassium supplementation if safe. Exercise 150 minutes per week. Limit alcohol less than 2 drinks in men and 1 drinks per day in women. Pharmacologic approach: first line drug, thiazide diuretic like chlorthalidone, indapamide. Mechanism of action: decrease sodium reabsorption from renal tubule. Side effect: decrease sodium, potassium and increase uric acid. Number 2, AC inhibitor like enalapril, ramipril, lisinopril block angiotensin 2, protect the kidney. Side effect: cough, increase potassium and angioedema. Number 3, angiotensin receptor blocker like losartan, telmisartan, valsartan. Mechanism action similar to AC inhibitor. Side effect: increased potassium and hypotension, but there is no cough like AC inhibitor. Calcium channel blocker like amlodipine, diltiazem, verapamil, nifedipine. Side effect: edema, gingival hyperplasia. Other drugs like beta blocker as metoprolol, bisoprolol, especially when the hypertension is associated with post-MI and heart failure. MRA, that is spironolactone, when hypertension associated is resistant hypertension cases. Loop diuretics, particularly when hypertension is present in CKD and heart failure. Alpha blocker, doxazosine, when hypertension is present with benign prostatic hypertrophy. Vasodilator like hydralazine and minoxidil, useful in resistant cases. Central agent like clonidine, methyl dopa, the last line agent. Treatment algorithm: stage 1, systolic 130 to 139, diastolic 80 to 89. For low risk group, lifestyle management only, but the high risk group starts the medicine. For the stage 2, where the systolic is 140 or more, diastolic 90, start medicine immediately. Combo therapy is common, like calcium channel blocker with AC inhibitor or ARB or thiazide. In resistant hypertension, add spironolactone. Special population CKD patient, AC inhibitor or ARB is useful. For diabetic, AC inhibitor and ARB, avoid thiazide if severe diabetic. For heart failure, AC inhibitor and ARB is useful with beta blocker and diuretics plus minus spironolactone. For pregnancy, don't use AC inhibitor or ARB, rather nifedipine, methyl-dopal labetalol are useful. For elderly, always remember, don't lower the blood pressure aggressively because it may cause fall of the patient, chance of fracture, accident and syncope. Resistant hypertension definition: blood pressure is more than 130 by 80 in spite of having three drugs including diuretics. Causes: poor adherence to the medicine. Secondary hypertension like chronic kidney disease, obstructive sleep apnea. Add spironolactone if possible. Consider vasodilator. This is a list of drugs like calcium channel blocker, AC inhibitor, ARB, thiazide, all the first line drugs. And the second line drugs are also mentioned here like loop diuretics, aldosterone antagonist, beta blocker, alpha 1 blocker, vasodilator. These are drugs mentioned here in their different doses and daily frequency and salient adverse effects. Key takeaway: always start with lifestyle measure. First line drug usually calcium channel blocker, angiotensin receptor blocker or AC inhibitor or thiazide. Add drugs stepwise. Most need two or more agents. Early control prevents stroke, myocardial infarction and chronic kidney disease. Thank you for watching.